Hello and welcome to YouTube channel Health Q, the place where our mission is not only to motivate you but help you to move on to the brighter side of the health. I am your host, physiotherapist Meghna Dave, and we are back again with our Friday live series where we bring on experts from different domain, different stakeholders of healthcare, so that we can talk more about different health concerns that people have around their overall health and well-being. And today's topic, today's this point of discussion that we have got is on cancer. Cancer prevalence, or is the number of people suffering from cancer, is increasing day by day. Not only breast cancer, but like head and neck cancer, brain tumors, cervical cancers, and other cancers like lung cancers, etc., are seeing a tremendous amount of rise. And along with this cancer comes cancer treatment and other residuals that makes living also challenging. No matter you are diagnosed with cancer in the early stage, you are in the mid stage, or you are in the later stage, you will face a lot of mobility or movement related challenges. And that's where you need help especially from a physiotherapist. So today I have with me Dr. Deepal Shah. She is a cancer rehabilitation physiotherapist. She has been working very deeply with cancer patients from different types of cancer and at different stages of cancer. And she has tremendous amount of wisdom when it comes to the quality of life that the cancer patient deserve and are not getting just because of the lack of awareness and lack of understanding of how important is mobility for them. So Dr. Deepal Shah runs a physiotherapy center in Ahmedabad. She is an expert therapist with us at HealthQ Rehab platform. And today she would be telling and sharing with us what are the common day-to-day challenges that a cancer survivor go through, and their stories she will experience, and she will also give you a lot of tips and understanding on how to manage these day-to-day challenges. So if you are a cancer survivor, or else if you are a caregiver, then this live stream is going to be very useful for you. Also, our comment section, the comment tab is live right now. So if you have got any questions, any doubts related to cancer rehabilitation or any other physiotherapy based questions, please feel free to type it in the comment section below. On that note, let's start today's live interaction with Dr. Deepal Shah. Hello, doctor. Very good evening.
Good evening, ma'am.
How are you doing?
Good, good. How are you?
Awesome. All well, all well. All right. So let's start our discussion without wasting any due time. Cancer. What is your take on it? What is something that people know about it very commonly, but what are few things that people just don't know about it?
Right. So, cancer is nowadays we have seen the incidence rate or the people who are getting affected by cancer have tremendously increased. It is not related to age also. Even pediatric patients are coming with cancer. So, it can affect at any age. And it's not related to your profession also, whether you are following all the healthy lifestyle, even then some of us are getting cancer nowadays. As we have seen, the awareness regarding cancer has increased a lot nowadays. So medical treatment is now available even in India. It has reached up to a standard where even people from out of India are coming to India for cancer treatment, you know. So we have reached that stage where even government hospitals are well equipped when the patients are getting excellent treatment there also. So cancer is very well, what we can say, people are coming out of it. Cancer, the treatment is long, obviously. So they may have to go for surgery, for radiation, for chemotherapy. It's a long treatment, long process. Later on, medications also. But what we don't know about it, how is life after cancer? After you have survived the cancer, you are a cancer survivor, you have completed your journey of cancer. But after that, there are some things which happens, secondary complications because of cancer, or maybe because of the treatment which was given for cancer. So who takes care of these secondary complications? That's where physiotherapists come in picture. That's where cancer rehabilitation comes in picture. And rehabilitation is a teamwork basically, where there may be it's an holistic treatment approach. So physiotherapists play a key role in rehabilitation part, because physiotherapist takes care of all the physical um, movement disorders, mobility disorder, or pain related problems, or anything related to your physical health, which is affected because of the cancer or the treatment of cancer, that can be easily managed if proper physiotherapy is given at right time. So this is the part where awareness is not that much. Even sometimes, even after the completion of treatment and patient has recovered, has got fully recovered, but there are some minor issues which can compromise their quality of life, which can be we can manage them. So that is the part which requires attention nowadays.
Right, right. So, what according to you are some of the common challenges that can be very easily solved if just patient know about it upfront, and then they can start working on it very immediately as soon as they know.
See, very commonly, if we see, like, irrespective of what type of cancer you have or what stage you were in, and your treatment has been done, but throughout the cancer, people feel that cancer-related fatigue. This is the most common complication of cancer, and also because of the treatment which is given for cancer, that can also cause fatigue. Now,
Mm-hmm.
fatigue is not just, it's not related to your physical disease, not just because of cancer, but because you have reduced your physical activities, because of the chemotherapy that is given to the patients. So there are some stages during which
Mm-hmm.
the patient might get fatigue, their cardiopulmonary endurance, or what you can say stamina, is reduced at some level. But if the proper rehabilitation protocol has been given since beginning, since the starting of the treatment, like before chemotherapy, before radiation, even before surgery also, if some breathing exercise or some movement protocol, if we give rehabilitation, then fatigue is fatigue won't hamper their day-to-day activities at least, and they will remain independent. Of course, there
Right.
are some days where, like on the day of chemotherapy or for 2, 3 days after chemotherapy, they may feel if weakness or fatigue is there. But it should not be continuous. It should not be a part of their, like, they should not accept it as a lifelong complication which they have to
Mm.
manage.
Correct.
They can easily come out of it. So fatigue is one of the major issue with cancer patients.
Right. Right. And
So they
if we
reduce their
talk about
physical activity. So what happens? It's a cycle. So they reduce the activity, and then again it will give rise to another complications.
right, right. Makes sense, makes sense. So let's say if we talk about stage wise cancer, like let's say someone who has developed cancer initially and has gone through just radiation or chemotherapy, if we can go more deeper into it, what are the common challenges they will face? Let's say if a patient has gone through a surgery, what are the different set of challenges that he or she can face? And let's say if someone is in the later stages, end stages of cancer, palliative care, what kind of common complications or challenges they can face and how we can deal about
Right. So basically, we can, what you can say, physiotherapy can play a very beneficial role, even just chemotherapy or radiation is to be given. If before those sessions, patient is given some amount of knowledge or education about what might happen. after radiation or after chemotherapy. So they are well prepared. What are the complications that may happen, and how to manage them immediately if you get any symptom, how to manage them. Plus, they are very well prepared, psychologically also. So they can deal with it if it comes. They are not like totally unaware about it. So what we do is if one session is done prior to radiation or chemo, it is the best. They can start as soon as possible. Then radiation related issues are what happens is because of those radiation, the tissues and the skin gets fibrosis. So the tissues gets hardened and it restricts the movement depending on the area affected. Like if
Right.
for head and neck cancer, if it is given, then their mouth opening, their neck movements, those are going to get affected. So during radiation therapy also, suppose if it is given to head and neck patients for mouth cancer, then immediately radiation is given every alternate day,
Okay.
okay, for a month or so.
Hmm.
So they have to take minimum at least 15 to 20 sessions are there. So
Hmm.
what happens is during that time that they are not moving their mouth completely.
Hmm.
Okay, so it gets very restricted. Movement becomes so restricted that then they are not able to open their mouth to even
Hmm.
drink water or for food also. It becomes very difficult
Hmm.
because of fibrosis. The mouth opening becomes very difficult and painful also. So, if with radiation therapy, this physiotherapy guidance has been given, they can do carry out at with
Hmm.
treatment also.
Hmm.
There is no harm. Whatever the opening is there, they can continue doing it. It is not
Correct.
going to harm their healing.
Right. Right.
So
Big.
it becomes very beneficial. So after, as soon as the radiation is finished, completed, then we can go for aggressive physiotherapy. So the complication of mouth opening can be easily avoided.
Right. And
That is
how
just
about
example for radiation. Like for
correct?
chemo again, chemo gives overall weakness and fatigue. So patients are taught some breathing exercise, some movement, some activities depending on their previous lifestyle, depending on their
Correct.
previous strength.
Hmm.
So we can guide them what they can continue even after taking chemo. They don't need to worry about anything and they can continue doing
Hmm.
activities.
Right. And how about the palliative care or later stages? What are the common challenges that can come, and how we can address that?
Palliative care is slightly difficult because they are managed with minimum of maintenance dose of medicines, supportive medicines. So most of the time they are very weak.
Hmm.
Most of them are bedridden. They are hardly moving. So what we do is we give them as much as supportive, like use walker or stick for walking.
Correct.
Then their muscles have become weak, so back pain may be there. So they are not able to sit. So they keep on lying down. If they are bedridden for a long time, then they may get bed sore also. So we
Right.
have to keep changing the position. Along with that, we can give them supportive like belt, lumbosacral belt, or any assistance which can help them to sit, stand, walk, how to manage the posture, how to maintain their whatever physical strength is there.
Hmm.
We try to maintain it, and along with
Right.
that, prevent joint stiffness because if
Hmm.
joints start getting stiff, then again it will be painful for them. So
Correct.
our main idea is to make them as comfortable as possible and remain as independent as possible. These are the only goals for palliative care.
Palliative care. Makes sense. Makes sense. Right. So now let's move on to the day-to-day tips, like how to manage day-to-day life. So let's first start with the patients who are into the chemotherapy or radiation stage, right? So as you said, in these patients, chronic pain or fatigue would be more prevalent or more common, right? So what will be your top five tips that any cancer patient in this stage can follow?
Right. So even during chemo or radiation, or even if surgery is done, like for some cases, like for breast cancer or any other cancer, surgery is done, and then chemotherapy sessions are given, or they have taken before also. But mostly after surgery also, they have to take 4 or 5 chemo sessions. So it takes around 1.5 months for them to completely finish those full treatment, this treatment. So what we do is we start, physiotherapy rehabilitation in a way that during those treatment phase, when they are still under chemotherapy or radiation or whatever, so they can remain as independent as possible. So mild, gentle exercises which they can carry out for daily activities are they are comfortable with doing all their daily activities, that we make sure of. And once this phase is over, treatment part is over, then comes the real physiotherapy part, where we, depending on the area affected, we focus on rehabilitation of that part mainly. Like if breast cancer was there or surgery was done, then upper limb requires more movement and strength protocol. Then we go for it. Then again, along with that, the prevention of lymphedema is very crucial. So with that, we start that also. Then we advise them for walk, go for a walk at least 30 to 40 minutes daily. Start with 5-10 minutes. That we advise them from beginning only. And what they can do all these activities at home also. They don't need to go out anywhere. We just teach them how to do those exercises, all the exercises, active exercises. Initially, it
Correct.
may be active assisted. They may need some assistance, but then gradually we make them as independent as possible, and they start doing active exercises. Most of the time, within a month, patients are back to their normal routine. Like if housewife is there, then she will start doing her all the activities, cooking and everything, cleaning and everything. What we advise is you have to break down your activities. Like you can't go at a stretch. Like, we have this habit, especially housewives, when they get up in the morning and then they're on their toes and working around the clock, and till
Correct.
afternoon they won't get
Right.
any rest. Only
Right.
after finishing lunch time they'll sit for some time or maybe sleep. So for cancer patient, what happens if you reach up to your exertion level, then you will get very tired, and then to recover from there it takes time, so then half of the day will be very inactive. The
Correct.
half days may be active, but then after afternoon they may not be able to get back to that energy level where they can do simple movement also.
Right.
So what all patients are advised is they have to break down their activities, modify in such a way that do all the work, all the housework or all the professional work, whatever you are doing, but you don't go up to that exertion level.
Hmm.
You limit yourself before that level. If I'm going to walk for 10 minutes, I'm going to get very tired. Then you start with 5, then gradually go for 7, 8, 9. Gradually, you increase your stamina. Just like
Correct.
that for cancer patients, even whatever profession you are there, they don't need to take rest or leave their profession or leave their work. What they have to do is modify in such a way that they break down, pace your activities, even exercises also. We
Right.
don't tell them this, you have to exercise for half an hour continuously. We tell them,
Correct.
do these 2 exercises, then after an hour, do this 2 exercises, then after an hour, do this 2 exercises. So we break down also. I always give protocol like that.
Correct.
Otherwise, what happens is sometimes patients do all the exercise all together and then they get tired, and they may feel like
Correct.
exertion ho gaya and pain is there, and they get demotivated then.
Hmm. Hmm.
Then it is not advisable for them.
Correct. Right.
That is the main point. We don't, otherwise, they are free to do whatever they want to do, but they just have to keep this in mind.
Right. All right. So let's move on to the next category of patients who go through surgery and how they can manage. What are the top 5 tips which they can follow on a day-to-day basis to have a better quality of life?
Okay, for surgery also, whatever surgery is done, Mostly after the whatever drains are there, or all those things are removed and stitches are taken care of, then first of all they have to start with breathing exercises, which we teach them before surgery also if possible. Otherwise, immediately after surgery, they have, so that their lungs are in normal functioning
Right.
normally, and
Right.
they don't get this breathlessness or any issue related to, because even not cancer surgery, even after any surgery we have seen the chances of lung infection and getting this problem, it is very common. So to prevent
Mm.
that, first of all, we have to give them spirometer and teach them some breathing exercises that they have to carry out regularly.
Right.
We can start these exercises from the first day only. Then next is again limb movements. Active limb movements they have to start as much as possible. If the area of surgery is still disturbing or painful, then taking proper care of that part, and then we have to, coordinate with surgeon also if there are any restrictions or limitations of patient. Like if bone cancer is there and the part is removed, then in bone cancer, if even if the one limb is affected, then all there are chances, there are there all the throughout the body their bones must be weak, you know,
Mm.
even if they are not directly affected by cancer. So while
Right.
mobilizing these patients, we have to be very careful that they don't get any injury and prevent fall. We cannot go for aggressive treatment, because if they fall, their bones are so brittle that they can
Correct.
break down anytime.
Mm.
Just like for palliative care also, their bones and all, they don't have strength. If they fall,
Mm.
they're going to get the fracture immediately, even with minor
Mm.
injury. Like one patient was like cleaning the, the water. She got up to get water, and just minor something she touched with wall or something like that. With just in a fraction of a second, she got fracture.
Mm.
So, this they have to keep in mind. So,
Mhm.
avoid weightlifting gradually.
Mm.
Then, after training, they can go for weightlifting, but initially,
Mhm.
prevent any kind of weightlifting, especially if breast cancer patient is there and arm is affected. Then, from that arm, they cannot lift. Like if mastectomy is done, then with right arm, they cannot lift weight
Right.
immediately. Later on, after proper
Mm.
physiotherapy, they can.
Mhm.
But
Correct.
initially, that is so breathing exercises, active limb movements. Then this take care of their weightlifting. Then start walking as soon as possible, because walking will give improve their overall stamina also. So start
Correct.
walking. And fifth is depending on the area of surgery, the area is affected. Like as I said, if breast cancer is then lymphedema may happen. So how to
Correct.
prevent lymphedema? What is
Right.
the supportive sleeve they have to wear immediately
Mm.
according to
Correct.
their condition? How
Correct.
to wear, when to
Mm.
wear, for how long they have to wear. These guidelines are given by physiotherapists, so they have to
Right.
follow them.
Right.
Then suppose if head and neck cancer was there, then again if after healing they have to start doing this
Mm.
neck exercise, shoulder exercise, mouth opening exercises.
Right.
So after surgery, these are the points they have to be careful about.
Careful of. Right. Makes sense. And how about fibrosis and suture? Any tips on that if you would like to give?
Yes, fibrosis sutures again. The if scar is there, then in physiotherapy we have techniques to mobilize the scar also. So to encourage healing, so they have to follow those treatment advice which is given. They have to
Mm-hmm.
also follow the cleaning part immediately, if at least till the healing is complete.
Correct.
Then scar mobilization is very crucial, because if it is not done, it may give rise to restriction and adhesions.
Correct.
So
Correct.
we encourage as much as movement, also active movement to start with, and with that, physiotherapy is done.
Awesome. Awesome. Makes sense. Right. And overall, this what is the role of mental health, and what are the tips from a mental health perspective you would like to give, not only to cancer patient but to caregiver as well?
Right. So cancer definitely affects the not only the patient, it affects the family also. The
Right.
whole family is get somewhere getting affected by this disease. So the most of the time, what happens is patient is more worried about family
Correct.
rather than themselves.
Right.
So it is a journey, and just like the team of doctors are required to work on cancer patients,
Right.
just
Mm.
like that, the patient also needs family, friends. Sometimes the other groups are there, supportive groups,
Correct.
which where they can connect with the same type of patients where they can share their journey. They get some inputs also, knowledge also, that they feel comfortable.
Right.
So, first of all, it takes some time, but once cancer is there, you have to accept it
Mm.
and then do your best. Even family and friends are there to support you. So, it's just that when you start accepting your condition and you become the leader. Patient
Correct.
becomes the leader.
Right.
So whatever is there, whatever they can do, they will do their best. Just like doctor, oncologist, oncosurgeon, even psychologist, physiotherapist, all are there to help them.
Correct.
But
Correct.
family is the mm, prime position where they very much rely on their families and
Right.
friends. If they are there, I have seen the whatever stage cancer was there or whatever terrible or what you can say traumatic experience of treatment. Like
Mm.
after chemotherapy, hair loss is there,
Right.
many such issues are where because of appearance patients get very apprehensive. They don't go out, they don't meet people. But if you accept and let people also accept it, then it becomes very easy. The journey becomes easy.
True.
If you involve everyone. If
Absolutely.
you isolate yourself like this is my problem and this has happened
Right.
to me and now I have to pass through all his pain.
Yes.
So it becomes very psychologically it hampers the recovery also, the healing part also,
Mm.
and it's not overall good for their mental or physical health. So
Correct.
for their overall health, their family and the patient itself has to accept this and walk through this journey together. Like
Right.
even if my hairs are gone, how much important is that? It will come soon again, right? So
Correct.
no need to hesitate, no need to lock yourself in the room. Go out in the open. There is no harm. People are going to accept. Once or twice they may notice you, then they are going to support you even. So there is
True.
nothing to worry about it. It is very
True.
traumatic otherwise. You want to hide all the time this mental. It creates mental torture. So this the patient don't come for they stop going out. They stop getting
Right.
involved in any activities. They stop going out in social functions. So this mentality needs to change.
Correct, correct. That's very true, very true. So I think
Hmm.
not only the cancer survivor, caregivers also needs a lot of support, because the emotional trauma, the physical stress is equally falling on their shoulders as well. So any tips that you would like to give to them?
Yes, caregivers, they are what you can say. If they get worried and they are not supportive enough, it becomes very difficult for the patient to, pass through this phases of treatment even. At some stage of the treatment, patients get very tired and frustrated, but they have no option but to go for it. So I would suggest if required, caregivers should take some counseling
Mm,
if required, if they are not able to help them because it will make a huge difference in the recovery.
correct.
So caregivers should give as much support and encouragement, motivation to the patient as much as possible. If required, they can go for counseling so that they can help the patient in a better way.
Correct. Right. Makes sense. Makes sense. So, yeah, I think they're fairly important tips that you shared with all our audience regarding day-to-day activities and how to manage day-to-day life. I would here like to take a pause and to the audience like to let you guys know about our online program that we have created for cancer patients especially. So what we have done is we have been trying to observe and see what are the common challenges that a cancer survivor go through on a day-to-day basis. And we have observed certain patterns, certain common issues like as Dr. Deepal already mentioned, fatigue is there, chronic pain is there, emotional stress is there, and even the fibrosis and the scar pain is there. So these are some important challenges that I think a cancer survivor will experience in the journey of this recovery, or as you can say, going through the cancer process. Now, unfortunately, what happens? Doctors are busy. Their job is to save your life, right? So, in the process, sometimes you might get missed of all the preventive things that you have to do uh, to make sure that those things don't cause trouble in future. A simple example as if a lady has breast cancer, then lymphedema could be a very potential complication that can come on the way, which hampers quality of life drastically and is not at all easy to cure. So, but at the same time, it can be prevented if we start acting on it sooner. So, we have come up with an online program where we help you, no matter at what stage of cancer you are at, with these secondary complications that can arise due to cancer. And we handhold you and give you support in this process. And Dr. Deepal Shah is the expert in this domain. So if you who are watching it right now and you want better understanding or you want to know more about this cancer rehabilitation program, feel free to reach out to us because that's where we would be able to understand at first place where you are at in your journey, and then we would be able to help you further. So, and on that note, I think today's session was amazing. Uh, we got a lot of understanding from you, Dr. Deepal, and it's great that you joined today with shared your valuable time. And yeah, looking forward for more such live interaction with you.
Life, yes,
Right.
definitely. Thank you, Magnamal. I
Thank
too
you so much.
enjoyed it. It was a pleasure.
Yes. Hopefully, we'll have more interactions like this in future, and
Yes,
we will see
definitely.
you. All right. Okay, guys.
Okay.
Thank you so much.
Yeah,
Thank you for
bye.
this. Bye.
Thank you.
Thank you.